Sheep and goat pox. The occurrence, it's endemic to Africa and Asia. Europe has been free since the 1970s and there can be sometimes sporadic reintroduction. New Zealand and Australia are also free. The etiology of the disease are the sheep and goat pox viruses. They're two separate viruses. You have the sheep pox virus and the goat pox virus. They're very closely related. They're both in the Capri poxvirus genus. For the epidemiology, it's a notifiable disease. It's a zoonoxin virus, but only sheep and goat are susceptible, and European breeds are more sensitive. The virus can be transmitted between sheep and goat. There's cross-immunity. It's a generalized pox virus and it can cause intrauterine infections. It is shed through the saliva, semen, and respiratory discharge, and in scabs. It's a very resistant virus, and it's also shed through insect vectors. There is a lifelong immunity due to maternal antibodies. For the pathogenesis of the disease, it's an aerogenic infection. The primary replication happens in the respiratory epithelium. This leads to viremia, and it's a generalized infection mainly. It can infect the respiratory tract, GI tract, and the fetus, and in the case of a uterine infection, it can cause abortion. When it affects the respiratory tract, it affects the lungs, and it causes lymphoma-like nodules. For the clinical signs, it has general clinical signs, such as fever, anorexia, and lethargy, and the sheep fall behind the flock. And then there can also be respiratory signs, such as coughing and nasal discharge. These flu-like symptoms happen next, and then we can have skin nodules on the face, tail, anus, and in places with no wool. Dark and hard scabs form. There can also be swollen eyelids. In the case of sheep and goat pox virus, goats show less severe clinical signs, and it's a much milder disease. The mortality can be around 70 to 80% in young, so it can be very high. And animals lose weight and the milk and wool production decrease, and it causes economic loss. In the pathology, we can expect to see interstitial pneumonia and black pock marks, and interstitial nephritis and skin nodules. The diagnosis and control are very important because it's a notifiable disease. The clinical signs can raise suspicion because it's a notifiable, but you have to detect the antigen, it's obligatory. The virus can be detected directly through a PCR and virus isolation, and indirectly through serology and viral neutralization and ELISA. In viral neutralization, it has a cross-reaction with lumpy skin disease virus. For the control, the endemic areas are Africa and Asia, and there's a subcutaneous attenuated vaccine. But for countries free from the virus, or there's no vaccine, you follow epidemiology measures such as quarantine and prohibited imports from endemic regions, and you follow eradication measures.